All right, welcome everyone for the next installment of Chat with Arkansas Founders. I am so really happy to have Dr. Amy Hester with us today for a number of reasons. Not only is she a fantastic example of a successful Arkansas-based healthcare startup, but she also happens to be uh, like partners with me from the very start in HealthTech Arkansas. She came on as our clinician in residence and has been with us every step of the way and has seen a lot of changes during that time. So it really, really is an honor to chat with you today, Amy.
Thanks, Jeff. I'm glad to be here.
So maybe let's start out with HD Nursing, the company you founded, and you're now CEO of that company. So maybe just give us your elevator pitch. What does HD Nursing do?
Yeah, so HD Nursing provides patient safety solutions to improve falls and pressure injuries across the continuum of care. That's our one liner.
That's awesome. And I know that's an oversimplification of all the things that HD nursing does. So maybe give us a little more context around the origin story. Why did you start this company?
Yeah, so that's a good question. We we never intended on starting a company. That was not something that Dees Davis and I ever thought we had in our DNA. But we had done some patient safety work at the University of Arkansas for Medical Sciences. That's where I grew up and practiced for a very long time as a nurse. And Dees Davis was a colleague of mine there for many, many years, decades, in fact. And what we developed there was a better way to identify and manage fall risk in inpatients, hospitalized inpatients. And falls are a really big problem for hospitals. They're regulated by CMS and Joint Commission. They're financially penalized to hospitals if a patient falls. All of the costs that's associated with that are costs that the hospital has to bear. They can't bill out the insurance company for any of those fall related costs. Those quality outcomes are reported publicly through Leapfrog and other agencies. So they reflect really heavily on your public reputation as people are seeking, providers for care. And so there's a lot of financial, regulatory, reputational incentives for why hospitals need to do a better job at preventing both falls and pressure injuries. Falls was where we started, and we developed a really efficient and effective way for managing and mitigating falls in the inpatient setting. And we knew we had intellectual property there to protect once we had developed everything. And we went to the Copyright and Patent Committee and got tons of excitement from our physician colleagues, which was absolutely shocking to us. We did not anticipate that at all. And so right away, UAMS BioVentures, their tech transfer office, was insisting that we form a company around the intellectual property that we had taken to market. And it took them almost 9 months to convince us to form a company. We were not prepared to do that. I was a clinician. I was not a businesswoman in any respect whatsoever. And I did not find myself at that point prepared to launch a company. So we finally decided to start HD Nursing after we realized that if we wanted to touch as many lives as we possibly could with what we had developed, we needed a commercial vehicle to be able to do that. If we wanted to control the dissemination and make sure that people used our intellectual property correctly, we needed a commercial vehicle to do that. And if we wanted to perpetuate a future roadmap of research and development and patient safety science, we needed a commercial vehicle to be able to do that. And so those were really the three things that caused us to finally make the decision and the leap to form HD Nursing.
That's really remarkable. It sounds like a little bit like that you sort of felt like you needed to start a company and were convinced or persuaded to do so, as opposed to so many of our entrepreneurs who kind of feel like for a long time they've had it in their blood and they try a number of different things, different startups before they hit one that really connects. So your story is definitely a little bit different. One of the things that I have often thought is that founders who start with a scientific or a clinical background and then learn the business side of things, it's sometimes a more effective path than, let's say, a general business person, more like me, who then, at some point in their career, attempts to to take on the science and the clinical background of a healthcare startup. So, what's your perspective on that? I mean, you were a clinician first, and somewhere along the way, you said, "All right, I'm going to lead this startup." And so, tell us about your journey to acquiring those skills, the business skills, to help you lead HD nursing so effectively.
Yeah, so there's a lot to unpack in what you just said. Um, I think the first thing, if you think about being a business person and then a scientist versus being a scientist and then being a business person, I think one of the big advantages in being the scientist first and the business person second, with respect to healthcare, is that when you're a clinician or a scientist first, you really understand all of the things that are baked into that, from not only the science of disease and disease management, but also all of the clinical aspects of what goes into making that happen. And I did have a lot of administrative experience before I formed HD Nursing, so I really had a good understanding of operationally, how does a hospital work, what makes it hum along. So it wasn't just having a scientific view as a clinician, but also as an administrator and having kind of the business operations of a hospital. How does supply chain fit into how a clinician provides their care, and what are the other things that are all wrapped into that? And then beyond that, then getting that business acumen and really putting all of that experience to work in the context of a new startup. So that was really, I think that was really beneficial for me. And I think you've seen along the years that business and operational experience and clinical experience blend that I have in the hospital setting helps HealthTech Arkansas help our startups to grow faster and farther, because I just know how to break those barriers down. I think when you're trying to do it the other way around, it's really a duck out of water. You have all the business pieces, but what normally happens in a business world, in a finance world, isn't always the way that we approach things in healthcare, because of regulatory requirements and the fact that you're not dealing with production of widgets, you're dealing with saving lives and keeping people healthy or getting them better. And so the transition back the other direction is a little bit more difficult, I think, with respect to healthcare particularly. um, and I would say what helped me with that transition is the people that surrounded me. I was really surrounded by all the right people. I didn't have anybody that told me, no, you couldn't do that. I didn't tell me, I never had anybody in the early days say, you're a woman, you're not going to do that, or you're just a nurse, you're not going to be successful. And so I think having those cheerleaders in my corner early on really kept me going.
Yeah, that's fantastic. That is really awesome. And and I think honestly, one of the cool things about your story, Amy, is that you have you set an example of, especially I think, for female clinicians in Arkansas. We have a story here that they can follow. And in our work at HealthTech Arkansas, we have found that there are so many clinicians walking the halls of our health systems who have ideas for new innovations or better ways of doing things. And a lot of times they don't know what to do with those ideas. But I think the more that we can encourage them to tell us about their ideas and then show them success stories of people like you who have done really great things on the business side, that in fact a clinician can learn the business side of a startup and run that effectively. I think it just benefits our state. I mean, there's no doubt about it. And, we need more clinician-led startups. I really believe that, and I think your story is a great one from that standpoint. Which I think is the next transition into the next thing I wanted to talk to you about, because our newsletter this month, we're actually talking about female founders, including some of the particular challenges that they have, and sometimes their rise. And so I wanted to mention a couple of Boston Consulting Group studies that I've come across recently and kind of get your take on that. The first study is that female founded startups attract less investment capital, which is probably not a surprise to anyone. Proportionally, it is just harder for female-founded tech startups to get venture capital specifically, but that those female-founded companies that do get capital are more successful than their male-founded startups, particularly in revenue generation and return on investment. The second study was even more sort of eye-popping to me. It indicated, and both of these studies we're going to reference in our newsletter so people can go back and check this out in more detail. But the second study indicated that we could grow GDP in the United States, or no, worldwide GDP by up to $5 trillion if females participated equally in entrepreneurship. In other words, if as many females proportionally started companies as males did, and if those females had equal access to capital that males do, that worldwide GDP could grow by up to $5 trillion just because female founded startup companies do better. So I'd love your take on this.
So I would say, one, I agree with all that, and it was definitely that was consistent with my experience. We had two angel investors early on for HD nursing, and they were both males. One was a neurosurgeon, so he really understood and had an appreciation for exactly what our company was about, and so we were lucky in that respect. And um, the other was just an investor that took a leap of faith. It was something very different for him. He saw it as something interesting and different than the traditional investments that he had made in his portfolio along the years, and so he was just bored with what he'd been doing and wanted to do something different. He actually takes an active role. He's the president in the company today. We're with each other all day, every day, and have an absolute ball doing what we're doing because we were able to form a relationship early on, and he really he saw value and um, got a different sense of satisfaction out of not just investing in something that made a widget and they sold a bunch of those widgets and everybody made a lot of money, but he actually sees how we touch people's lives and the ripple effect of positivity when we come in and drive results in reducing falls and pressure injury and reducing suffering in those that are already suffering. So there's a lot of ways to get a lot of satisfaction as an investor out of that. I did see the BCG study, and I will say one of the things that I really liked about that particular presentation was that they didn't just cite that there was a problem. They gave investors and founders alike strategies to tackle the problem itself. And the other thing that they pointed out was that it wasn't the fault of female founders that they didn't get the same funding that males got. It was a systemic issue. It's a system that's been brought up outside of the context of having good female founders out there, and that is I think that's one. I think it's good and it's fair for the female founders out there to point that out because it's true.
Yeah, I completely agree. If you'll remember back to all the way back to 2018, our very first HealthTech Arkansas cohort, three of our six companies in that initial cohort were female founder, female led. A fourth company had um, a female co-founder. So we'll say three and a half of our six companies had female founders. And I think consistently, if you look across all of our cohorts, we're overachieving in that area as a proportionally related to all tech startups. I think nationally, the HealthTech Arkansas cohort, we have overachieved in that area, and I think it's not just good for for us as in terms of society to see more female founded startups, but apparently it's good for our investors too. And so I think that hopefully we'll see that trend continue as we move forward. Um, all right, so you have been with us for since day one at HealthTech Arkansas. Um, what what do you see? How do you see our evolution as an organization, and what do you think we can continue to do to deliver impact for the state of Arkansas? Because that is our mission. All right, we want to improve health outcomes and help people innovate, in particular our health systems across the state. So, what can we do to continue delivering impact to them?
I think one of the things that you could and should continue to do is this notion of innovation centers. So, what you've done with Arkansas Children's and the Innovation Center and being able to reach clinicians directly and give clinicians an outlet and an avenue for bringing their ideas and their innovations forward in a structured and meaningful way that thinks about all of the things that needs to be baked into those, the incubation of that, if you will, to make sure that you either fail fast and move on to the next idea, or you find success early and you move that success and are able to propel that and accelerate that. That is, in my mind, one of the best ways to really move innovation to the point where it actually touches somebody's life here in Arkansas. It takes a long time to get from an idea in a clinician's head to where it's coming to life at the bedside in a routine and standardized and measurable way. And so when you can break down all those barriers that create that long length of time for that to happen, you just accelerate the ability for those positive things to touch the lives of Arkansans. And that's what I see you guys doing, especially when we have focus on cardiac health and cardiac related startups. We're the buckle of the the heart failure belt and the stroke belt here in Arkansas. So if you think about technologies that are going to touch the lives of Arkansans and make a huge difference in the morbidity and mortality of Arkansans, having that focus, I think is a great way to show that you're doing that.
Yeah, that is such an excellent point, and it is a good prelude to what you're going to hear from us in the next couple of months regarding some really important announcements that we're making. But you're right, when to focus an accelerator, for example, on cardiovascular care, really kind of opens us up to developing national partnerships with organizations that can help us do work in other important clinical disease areas as well. So I think that's a really cool thing. And related to our Arkansas Children's work, I mean, my goodness, that has been so good for HealthTech Arkansas. I think hopefully it's been really good for Arkansas Children's as well through our partnerships with the other ESOs around the state. But we have learned so much in almost 2 years of working with them that we can then now take that to our other major health systems around the state and deliver that same kind of value with internal innovation programming. All right, so last question for you is we're going to flip the script, and I like to do this. So we started this last month with Misty Staley, and I want to continue this trend of flipping the script and allowing you to ask any question you want of me. I've had no prep. You haven't told me what you're going to ask, but I'd love for you to ask me anything at all about HealthTech Arkansas or anything else in general.
Yeah, so I'll ask you a personal question. Um, so,
Excellent.
when I first started really learning the entrepreneurial ecosystem, one of the first things I learned is there's a lot of really great Jeffs in this state, and you are certainly one of them.
That's
And
right.
and but you're not a clinician by background. So my question would be, I mean, one of the things that's been great about the entrepreneurial ecosystem of Arkansas is it's really started to refine itself in the last few years so that our accelerators and incubators really have a more defined scope, whether there's a group of, there's a collective that focuses on finance or a collective that focuses on healthcare. We really seem to have sorted out our talents really well in the state to funnel resources to the right startup at the right time. So my, obviously there's a lot of opportunity for participation in startups in the entrepreneurial ecosystem. So why did you choose healthcare over finance or some other realm of startups, knowing that healthcare is hard? It sometimes it takes a lot longer. There's all the regulatory FDA stuff that's wrapped up in that. So why healthcare for you?
Yeah, it's a good question. Thank you for that. So first of all, in terms of the other Jeffs, two of the more prominent ones, Standridge and Amorine, I'm just glad to be included in that conversation. Anytime people talk about the three Jeffs, I'm just delighted to be in that company because, as you know, they've done just really amazing things here for the state of Arkansas. But why healthcare? So all the way back to 2017, when I was working with Warwick Saban at the Arkansas Regional Innovation Hub, Warwick had developed a couple of really important partnerships with Baptist Health and Arkansas Blue Cross and Blue Shield. And he asked me about this concept of starting a healthcare focused accelerator. At the time, the state of Arkansas was delivering funding for industry based accelerators, and the accelerator grant funding that came out basically said if you choose a specific industry and you can attract corporate partners, then the state of Arkansas will fund an accelerator program because that's important to our state. We want the economic development benefits and the innovation benefits that come to the state of Arkansas through that. So we talked about that. I had previously served as the corporate director of marketing for a home health care company in Nashville, Tennessee. And so I learned a little bit about healthcare during that tenure. So it wasn't a foreign industry to me. So Warwick and I talked about it and decided to launch it. At the time, it was branded HubX Life Sciences with Baptist and Blue Cross. And we learned a whole lot from that very first cohort, including the fact that we didn't really know how to run an accelerator. So that first year, we really had to get our legs under us. But then it just sort of grew from there. And we've just been so delighted that along the way, we've started with UAMS in 2018 with our very first pure, provider-focused healthcare accelerator, and we've grown the coalition ever since. We now have the state's 10 largest hospitals and health systems, and we continue to add to that coalition, and I'm just really, really happy. I mean, it is interesting as a pure business person how I overcome some of the knowledge gaps related to the clinical work that we do. And as you know, I rely on you and Dr. Stephanie Benton to help me in that regard. And at our heart, we're a clinical program, and we could absolutely not do it without you and Stephanie kind of leading the charge for us in that way. So probably more information than you wanted to know, but that's my answer.
No, it's good. I feel fortunate that you have landed where you are. I think you're making a huge difference for the state of Arkansas and Arkansans. I think it's amazing to have an advocate like you, and Jeff Standridge and Jeff Emerine have certainly been positive impacts on my career and my growth as an entrepreneur as well. So I'm very appreciative and personally thank you for all the contributions that you've made to me.
You're very welcome, and likewise, thanks for all that you've done for us. HealthTech Arkansas absolutely would not be here if you had not joined hands with me 4 years ago and started to launch down this path. So many thanks. And I've really enjoyed it. Thank you for this opportunity, Amy, and I'm sure we will see each other very soon.